Hi, Dr. Harold Pan here, physical therapist. Hope everyone's doing well. Today, I want to talk to you about what you can do almost to get almost immediate results if you're having issues of sciatica. I want to preface this by saying that this is not medical advice. If you are having any sort of problems that you suspect sciatica or a disc herniation or any sort of problem, you would want to consult a medical professional directly and have a consultation first, as everybody has differing issues that require a diagnostic process in order to treat. That being said, what I'm going to show you today can be immensely effective if certain conditions apply to you, and this is one of the most common conditions that you can experience if you ever have low back pain. Low back pain happens globally and very frequently, almost on a daily basis. And in the United States, opiate medications have been far overprescribed for these issues, and wrong diagnoses have been issued. And when you get the wrong diagnosis, you get wrong treatments. And when you get wrong treatments, you don't solve the problem. And that's when an acute problem becomes a chronic problem. When a chronic problem exists, then you have problems like disability and other issues down the line. So this is why you would want to address things faster and get the right answers from the right professional. Now, I want you to believe in what you're seeing. So I'm going to give you an example of a case that I just worked with. And by the way, this is not a one-to-one in-person visit that I did. This was a televisit. So I did not even have the opportunity to put my hands on this individual to suss everything out. I had to use things like proxy, by using the patient's husband to help out, by observing through video, by getting a detailed history, and by describing what this person should do. And even in doing so, we saw an immediate result in improving symptoms right away. So what was going on? Last week, this patient flew in to the state, went through the week, and then at the end of the week, so Monday flew in, Thursday started getting severe low back pain, with pain shooting down the buttock to the back of the thigh, all the way down to the back of the knee. She described it as sharp and stabbing, and at times tight. And the morning was terrible. The mornings were worse. Bearing weight on that side, that right side, exacerbated pain, and it would take 2 hours for any sort of resolution to happen. So what did she do? She went to the ER the next day, was given a prednisone medication and some Flexeril, some ibuprofen, had some modest results, but every day the same process for the whole subsequent 7 days. Every morning she would experience that same pain going down from her right side low back all the way down to the buttock to the back of the knee. Now, in the line of physical therapy and musculoskeletal care, this is what we would consider sciatica amongst other diagnoses. In this issue, there could also be a problem with a herniated disc, and I'm going to talk about these things today. Some things that you want to know, and what I noted, is the pain is not constant. It is dependent on movement and position. Things like sitting for a prolonged period of time, or laying down for a prolonged period of time, walking uphill, bending forwards, or turning to the side of the injured side, the side that was giving pain, that was all exacerbating. And when she did this, the pain would travel from her back down her leg, although on a more mild level. The pain at that time was described as excruciating at a 7 to 8 out of 10. After working through all of these symptoms and working through a quick intervention, it was resolved to 1 to 2 out of 10 and no peripheral symptoms. Now, what can we talk about here? Sciatica is also, in my opinion, something that's overdiagnosed, but it's also very common. The sciatic nerve is a combination of the peripheral nerves bundled up from nerve roots L4 and L5, and as well as S1 and S2, when it converges to form a really thick nerve that travels down each side of your back, down your buttock, through your hamstring before it splits in the calves. I'm not going to show you where the sciatic nerve is in your leg. But if you were to pinpoint it, essentially the one spot where you can always find reliably is if you could feel your sit bone when you're sitting down, or if you imagine yourself wearing jeans and you find the back pocket of the jeans, pushing on that part, that is where the sciatic nerve travels through the piriformis. And that is a muscle that sits over your buttock. Sometimes sciatica can be confused for piriformis syndrome, which are similar issues with some particular differences. I'm going to talk specifically about sciatica pertaining to the back. Now, another issue that comes up is a herniated disc. Now, a herniated disc is not a disc slip. There is no such thing as a disc slip. When that is being used as a medical term from a doctor to a patient, it is, no pun intended, a slip up by the physician. Discs cannot spontaneously slip from the back. I have a model here of a spine. Now, obviously this is not a real spine, this is a plastic model here, but you see each vertebral level here, there is a fibrocartilaginous disc in between, although in this case it's rubber. Now, in a real spine, there is covering. There's a lot of ligaments covering each level of disc here that will blend from bone to bone. That's very protective. It's one of the most protective tissues in the body. It's really, really, really strong. So why do disc herniations happen? Well, disc herniation essentially is it's kind of like, if you imagine what the disc is, outside it's very tough, but inside it is a little bit like a jelly donut. And gravity or certain exertions, like if you sneeze really hard and you haven't done much in a while, your body tends to be stiffer and weaker, or if you lifted something that's far too heavy for you, yes, you can exert yourself with so much abdominal pressure that a disc can herniate and extrude from its original spot. And in this case, this red little jelly bean here, that is the model version of a herniation. Notice how it is still connected to the rest of the disc here. And this model, it's a model, it's not even reinforced by ligament. It's pretty stable. What you will feel if you're experiencing this pain, though, is where this nerve root lies, and where you see the herniation, it's pushing on that nerve root. That nerve root combines with all the other nerve roots, and it goes down to the leg. And nerves are sensitive tissues. So you push anywhere along that pathway of the nerve from here all the way down to the back of your leg, you may feel some level of symptom. The more the herniation pushes on, the more aggressive and severe the symptom is. So that's why you want to find movements, positions, and activities that alleviate any sort of pain going down your thigh or your leg. When you have pain going down your leg, that is what we call peripheralization of pain. Peripheralization means pain in symptoms is going towards the periphery. That is not what we want. We want pain to centralize. When pain centralizes, it might be a little more intense, it might be deeper, but it travels away from your leg and goes closer towards your spine, closer in your hip, closer towards the back, because at that point, that pain is a little bit more related to the surrounding tissue around the nerve, like the muscle, the ligament, the bone, any sort of inflammatory factors that start healing. That is a good thing because nerves are delicate in comparison to the other parts of the body. So what we did is, my patient, she had trouble bending. When she was standing, she had trouble bending backwards. She had trouble turning to the side, and every movement of her spine was pretty limited. She was pretty stiff and tight, a lot tighter than what she would normally experience. She's normally kind of a flexible person. The other issues that she experienced were when you do something called a straight leg raise, or if you've ever tried stretching your hamstring on your back, where you lift your leg up with your knees straight and bring your toes towards your face, that aggravated her symptoms severely. As a sidebar, that don't ever stretch your hamstrings like that. When you bring your toes back, you're not stretching your hamstrings, you're stretching your sciatic nerve. Your knee should be straight, but your toes, your ankle can be neutral. So that brought about her symptoms. And one more thing that brought symptoms on, when she was rolling onto her bed and turning her body, that was all symptomatic. And when I had her husband push directly over the piriformis area where the sciatic nerve normally sits, kind of where that back pocket of the gene, that anatomic location, clothing wise, that also ignited the symptoms and created a peripheralization effect. What we did afterwards was very, very, very simple. I had my patient lay on her stomach, put her forearms by her side, and do the mini cobra pose, what you would think of in yoga. So where she would lift her head, chest, and shoulders up and extend her spine from there. Hold that for a total of 5 seconds, come back down, and repeat that 10 times. We noted after the first time she felt a resolution of symptoms in her thigh. After the 10th time, she felt no pain in her thigh. When she got up to roll and roll onto her back, she rolled further with less pain. When we retested the straight leg raise, she went further before she had an onset of symptoms. When we tested her ability to bend forward, bend backward, turn from side to side, she went further even though she was hurting. Now, what's the moral of the story? She was still hurting afterwards, so what's the point? The point is, if you're experiencing a problem like this, you'll know that it's not indefinite. It's not forever. It is temporary. And the faster you get to a point where somebody can put their hands on you or observe you and diagnose you and give you proper information and the proper things to do to address it, the less likely it is going to turn into a chronic issue, and the more likely you're going to experience a rapid recovery, or now you're not going to feel like you're stuck. You can go about your day. You can start doing some things related to your work. You can start going on walks, and you can see a light at the end of the tunnel, where this problem normally should resolve within 2 to 4 weeks. But if you don't see any changes within the first week, it's going to feel pretty hopeless. If you see changes pretty rapidly, you might still take that same healing timeline, but you're going to see those changes a lot earlier, and you're going to optimize your recovery process. So once your body's all healed up, you have a larger capacity to return to your prior level of function. Moral of the story, always get yourself checked out when you have a problem. Don't wait, especially if you feel like it's a threat. Low back pain is common. It's usually not something to worry so much about, but at the same time, we have medical insurance. We have great healthcare providers that are trained to address this problem. The earlier you address it, the less likely it will be anything to be worried about. And of course, yes, there's always a cost up front of time and money and energy, but it is well worth it to be as preventative and as prophylactic as possible. Now, if you enjoyed this, if you want to hear more content, please comment below, share with your friends, share with anyone who might benefit from this that you know, and let me know what you think. Engage, give your thoughts, and ask any questions. Other than that, have a great evening. Thank you.